Today, we're diving into a recent study published in Veterinary Surgery that explores a potential new surgical approach for a challenging condition in dogs: idiopathic chylothorax. This is a condition where lymphatic fluid, called chyle, leaks into the chest cavity, causing difficulty breathing and other issues. It's commonly treated with a surgery involving ligation, or tying off, of the thoracic duct, which is the main vessel that carries lymph from the abdomen to the bloodstream. Often, this surgery is combined with removing part of the pericardium, the sac around the heart, in a procedure called a subphrenic pericardiectomy. Traditionally, the thoracic duct ligation is performed via a caudal approach, usually on the right side, targeting the duct at the 8th or 9th intercostal space, which is the space between the ribs. However, a known challenge with this traditional approach is that the thoracic duct often has multiple branches at this caudal location. This branching increases the risk that some lymphatic vessels might be missed during surgery, potentially leading to the condition persisting even after the procedure. Some techniques like en-bloc ligation, where surrounding tissues are tied off along with the duct, have been developed to address this branching. But what if there was a location where the thoracic duct was simpler, perhaps with fewer branches? Previous reports hinted that cranial to the traditional site, specifically around the 4th or 5th intercostal space, the thoracic duct might be a single, left-sided structure in many dogs. This got researchers thinking: could approaching the thoracic duct from the left side at a more cranial location, like the 4th intercostal space, offer advantages? Perhaps it could simplify the ligation procedure and potentially improve outcomes by targeting a site with less complex anatomy. Also, if performing a subphrenic pericardiectomy is desired, doing so through the same incision as the thoracic duct ligation could reduce the number of surgical sites compared to the traditional approach, which often requires multiple incisions. The goal of this study was to investigate this idea. They aimed to look at the branching pattern of the thoracic duct in the cranial chest of dogs with idiopathic chylothorax using advanced imaging, and then to evaluate the feasibility and effectiveness of ligating the thoracic duct via a left-sided approach at the 4th intercostal space in
Based on these results, the authors confirm the feasibility of using a cranial left-sided approach for thoracic duct ligation in canine cadavers. They found that both the ligation and the unilateral subphrenic pericardiectomy could be performed easily and quickly. They emphasize that their findings support the need for further investigation of this cranial left-sided approach in actual clinical patients with idiopathic chylothorax. A key potential benefit they highlight is the possibility of decreasing the morbidity associated with surgery compared to the traditional approach, which often involves a right-sided double thoracotomy, meaning 2 incisions. A single incision at the left 4th intercostal space has the potential to reduce surgical time and anesthesia time.